The Core 20 is the most deprived 20% of the population nationally, so we're not creating any or widening or exacerbating inequalities between systems or between regions. And then we've provided local level flexibility by looking at plus population groups. So plus population groups could be a subset of an ethnic minority community, it could be an inclusion health group such as those experiencing homelessness or Gypsy Roma traveller communities, for example, but it could also be people living in a coastal community that are suffering from poorer than average access to healthcare services. Now, this slide explains the Core20Plus Connectors concept. So the idea is that we're building on the learning from the vaccination programme, so really working with our communities, trusted community voices, trusted community leaders, so that we can impart some key healthcare messages, but also listen and learn from our communities, understand what's really going on out there in our communities, and so that they can hold us to account for the priorities, and so that we can really start tackling the issues.
As a kick, and the real vision is ending health inequalities for Caribbean African people within a generation. And our mission really is that strategic engagement, because there are lots of peer support groups, voluntary sector organizations, really small. But what we know the need is, it's that policy influence as well as triangulating lived experience and being able to shape.
So National Voices is a national charity that brings together a coalition of health and care charities who've got over 190 members, including the wonderful Caribbean and African Health Network. Together with Healthwatch England, National Voices have been behind the scenes putting together a learning and support framework for community connectors as part of the Core 20+5 initiative. And so some of the things that have been happening behind the scenes have been a series of discussions and focus groups and working groups with people with lived experience of disadvantage and exclusion.
So I'm Merron Simpson, and I'm the Chief Executive of the Health Creation Alliance, and we're the leading national cross-sector movement addressing health inequalities through health creation. And our mission is to increase the number of years people live in good health in every community. Our ambition is for health creation to become business as usual across the whole system. We're working to bring about systems change from the bottom up, from the community to the front line, neighbourhood, place, system and national level. The whole programme is that getting the relationships right is central to success of the Core 20+5 members. Being connected to other people is very powerful.